Good morning. If I could ask everyone to come in and be seated, we will start on time. My name is Leonard Schaeffer, and I'm the chair of the Roundtable on Quality Care for People with Serious Illness. And that is the organization that is sponsoring this workshop today. The Roundtable was launched and inspired by the Institute of Medicine's Dying in America report. We operate with one important principle, which is to start on time and end early, which will be our goal for today, along with hopefully informing people about various important issues. The Roundtable is a convening opportunity for a wide array of folks and people interested in these topics. Are we going to get the slide? It's been explained to me, but my role in life is to make sure that the slide that lists the sponsors gets shown. There you go. So these are the sponsors of the Roundtable. And if you are interested in issues surrounding serious illness, I hope you will follow what the Roundtable does. And if you'd like to give us a lot of money, we are available to talk to you. So today's workshop is the third in a series of public workshops hosted by the Roundtable. Your materials list some of the previous workshops, and there will be more in the future. That concludes the paid political announcement. My colleague, the vice chair, who actually knows something about these topics, James Tulsky, has a few words.
Good morning. It's truly a pleasure to welcome all of you to today's workshop. And what I wanted to say was just a couple of things. First, that this is quite timely for a couple of reasons. First, this November is Hospice and Palliative Care Month, so it's appropriate that we be doing this during this time. And more importantly, we're watching in Washington right now as a budget, a tax plan, and a lot of other things are sort of moving their way through Congress. And I think a lot of what we're going to talk about today regarding healthcare financing is really apropos what's happening in Washington and helps us look at that through a particular lens. But the main thing I want to do today is to thank the two leaders of today's workshop who put this together, Mark Ganz, who's the CEO of Cambia Health Solutions, and Haiden Huskamp, who is the 30th anniversary professor of health policy at Harvard Medical School. This is a relatively unique and wonderful partnership of two amazing leaders, one from industry and one from academia, who are putting their heads together, and I need to thank them profusely for corralling what was not always an easy process because there are obviously very diverse viewpoints and ways of thinking about this, and bringing this together into what looks like is going to be an absolutely wonderful conference today. So without any further ado, I'd like to ask them to come up, and thank you again.
Good morning and welcome, everybody. It's great to see all of you here and see some people that I saw at the CTAC conference earlier in the week. So this is a Palliative Care Week here in Washington, D.C. I would be remiss if I didn't start by thanking a few people who helped make this happen. The first person I would like to acknowledge is Lori Gregg, and I don't know if she's in the room. But Lori, would you stand up? Because if this would not happen without Lori's leadership. She's the one that really makes us look good in all of this and is so focused on making sure that this is not only a well thought through day, but also that it's right on time. So she'll help us do that. The second person I would just like to acknowledge is Haiden. who really was, I think, the senior partner in this relationship in terms of planning this, being prepared for meetings and making this happen. And it's been just a pleasure to work with you and get to know you better in this process. And then I'd like to just acknowledge the entire team of people that you see up here on the screen. Could each of you who are in the room stand up and be recognized that we're on the planning committee? Thank you so much for your work. So this is the third in a series of workshops that have been focusing on this topic that is very important to the National Academy. Just to remind you, those of you who weren't at the earlier ones, to sort of catch you up, the first workshop introduced the voice of the consumer, which is really the place that this all starts, because the work that we're all doing all comes together and unites around the actual individuals and families that we're here to serve, to make their way through health and sickness as straight and as smooth and seamless as we can make it, and to maybe in some way, because of this roundtable and the workshops that we have, we'll do more to a better job of designing around the needs of individuals and the families, as opposed to designing and then just expecting that individuals and families are going to be well served by what we designed, because it really needs to start at that human-centered place. The second workshop focused on designing care models, which should be based on a deep understanding of those consumer needs. And that was an incredible conference. It was wonderful to be here. So a natural progression is today's conference, which is to talk about financing and payment. One thing to just keep in mind as we go through the day, and I think many of you who are in this room know this, but sometimes we make a mistake in healthcare policy where we say that the way to solve a problem is to just figure out some way to pay for it. That can often lead to having money paying for things that actually aren't improving the lives of individuals and their families. What is the focus here, and what you'll see from the incredible lineup of speakers that we have and panelists, are people who understand that payment is a part of the equation. Payment can be an accelerator of good work. It can also, if done wrong, can be an accelerator of incompetent work. But what you're going to see today are people who I think are highly competent, who are doing good work and understand that payment can actually be, and figuring out how to pay for the right things can move the dial. So think about that as we go through the day. And because this is an interactive workshop, be armed with your questions so that we all walk away with a better understanding about what we can do out there beyond the Beltway as we take our efforts forward to improve the lives of Americans. So I will turn it over at this point to Haiden, who will introduce a few more items and then the first panel.